Welcome to Heal Naturally. I'm Case Adams, a California naturopath, and I'm here to let you know about some of the latest research evidence proving that natural strategies can provide solutions to many of our modern ailments. Probiotics have been shown to combat many ailments. Now we can add bipolar disorder to the list. Bipolar disease is a relatively new naming convention for a condition whereby the patient suffers from bouts of depression and mania, often alternating or cyclical. In other words, bouts of high energy can alternate with periods of melancholy, sometimes depression. This was called manic-depression reaction for some time in the 1950s before the American Psychiatric Association decided to call the condition an illness. Manic-depressive illness. Later, bipolar disorder became the typical naming convention for a condition that affects many people differently. According to the U.S. National Mental Health Institute, bipolar disorder 1 may be affecting up to 2.8% of the U.S. population, and 4.4% may have suffered from bipolar disorder at some point in their lives, according to the research. Dr. Faith Dickerson and research associates from Johns Hopkins University School of Medicine studied bipolar disorder at a Shepherd Pratt Health System hospital in 2018. The researchers tested 66 bipolar patients who had come into the hospital with a manic episode. The patients were randomized and half were given probiotics in a capsule for 6 months. The others were given a placebo during the same time. The researchers found that about 50% of the placebo patients required hospitalization during the study, but only a third of that number needed hospitalization in the probiotic group. In other words, the probiotics significantly helped the bipolar patients to the point where there were only a third of the hospitalizations. Those patients who took the probiotics also required less treatment. The placebo group required an average of 8.3 days of hospitalization per stay. Meanwhile, the probiotic group only required an average of 2.8 days of hospitalization. Those who also suffered from systemic inflammation got a significant benefit from the probiotics according to the research results. The researchers used 2 strains of probiotics in the supplement. These were Bifidobacterium lactis and Lactobacillus rhamnosus. This is important because not all species and strains will work the same. Both of these 2 species are found in breast milk. They've also been found to help mind-body issues in other studies, as I cover in my book on the topic. We've discussed other studies that showed probiotics can significantly help depressive symptoms as well as anxiety. Several probiotic species produce positive results in these studies, including Lactobacillus acidophilus, Lactobacillus alivarius, Lactobacillus brevis, Lactobacillus casei, Phytobacterium bifidum, and Bifidobacterium lactis. As we can see from the study from Johns Hopkins, there are common species among the positive results. Other studies have shown that probiotics can significantly alter brain activity as well as emotional responses. The absolute finding among these studies is that our gut's probiotics affect our moods and our mental well-being. It only makes sense for us to consider these findings carefully, especially when so many in modern society are suffering from mental conditions. If you want to learn more about probiotics, be sure to check out my webinar called Microbes and Probiotics. You get a free copy of my book with the webinar as well. See the link in the description below. Hey, thanks for tuning in. To keep up to date on future health news, please hit the subscribe button. Take care of yourself.